Welcome to the Boehringer Ingelheim Parasite webinar series. In today's webinar, we'll be discussing terrible ticks. Ticks pose serious threats to both human and animal health, and so at the beginning of this webinar, we'll be looking in more detail at some of the problems that ticks can cause. We'll then move on to the tick life cycle, and we'll finish by looking at some of the advice we can give owners about how to control ticks in their pets. So, what is the big deal about ticks? Well, it's not always easy to know whether a pet does have ticks because often they're small and hard to spot, especially those earlier life stages. And unfortunately, they're much more common than you may think. So 1 in 3 dogs in the UK carries ticks. Ticks attach to the skin of the host and then feed on their blood, and this often causes irritation. But the much bigger concern with ticks is that they can act as vectors. So this means they can transmit infectious diseases, also known as tick-borne diseases, to humans and to animals. Tick-borne diseases are much more of a concern for dogs compared to cats. And so let's talk about the problems that they can cause in dogs first. The most common ticks found in UK dogs are Ixodes species, with Ixodes ricinus accounting for 9 out of 10 ticks that are found on dogs. And it's Ixodes species ticks that carry Borrelia burgdorferi, and this is the bacteria that causes Lyme disease. In fact, 1 in 50 ticks carries this bacteria. So Lyme disease is a chronic debilitating disease in dogs, often causing arthritis and fever, and sometimes even causing kidney damage and damage to other organs. It's also an increasing human health risk, as Ixodes species ticks can also transmit Lyme disease to humans. Another serious disease that ticks can transmit is babesiosis. The Dermacentor reticulatus tick is found in certain areas of England and Wales, and it can transmit the parasite Babesia to dogs, and it's this parasite that causes babesiosis. So Babesia invades red blood cells and causes anemia, and if this is severe, it can occasionally be fatal. So babesiosis has been diagnosed in dogs in Essex and in Hertfordshire recently. And the important thing to know about this is that these were dogs that haven't travelled outside of the UK. There is also a risk of tick-borne disease in travelling pets. So Rhipicephalus sanguineus is a tick that's not currently found in the UK, but can cause problems for pets if they travel abroad. Rhipicephalus can carry a variety of pathogens, including Ehrlichia canis, and also a number of pathogens that can cause disease in humans. And we're continuing to identify newer threats from ticks. So the tick-borne encephalitis virus, which was previously not seen in the UK, has recently been identified in ticks in the south of England and also in Norfolk. So what about cats? Well, ticks are less of an issue for cats than for dogs. Although they still suffer from the irritation of a tick bite, they're less affected by tick-borne diseases. And their grooming behaviour also reduces the numbers of ticks that they have. The most common ticks affecting cats are Ixodes ricinus. So now let's move on to the tick life cycle. So the life cycle starts with an adult female tick. The adult female takes a feed on the host. It then falls off into the environment where it produces thousands of eggs. Those eggs then hatch into 6-legged larvae, and these larvae attach to another host, which is usually smaller wildlife. And on that host, they then take a feed And again, they drop off into the environment where they then molt into the next stage, which is an 8-legged nymph. The 8-legged nymph then finds the next host. It takes a feed and once again drops off into the environment. And it's then that it can develops into the final adult tick, which then finds the next host and the cycle begins again. So in the whole life cycle, there are 3 different hosts involved, although actually the majority of the tick's life cycle is spent in the environment. And the whole process can take a number of years from start to finish. A big part of the tick's life cycle is finding and attaching to a host. And ticks do this by crawling to the top of vegetation and holding their front legs out in the air and waving them slowly, waiting for a host to pass. And this process is called questing. When a suitable host comes along, the tick uses its front legs to hold on to the host and then crawls along the skin through the fur until it finds a suitable spot to attach and then to feed. So ticks really thrive in grassy and woodland areas, but they can be found anywhere with vegetation, so even in back gardens. So how do ticks actually transmit disease? Well, firstly, the tick needs to become infected itself, and it does this by feeding on an infected host, also known as a reservoir host. The pathogen then stays in the tick's gut until it feeds on the next host in the next stage of its life cycle. At this point, the pathogens migrate to the tick's salivary glands, and this is called the initial slow phase of feeding. Once this stage is over, we then enter the rapid phase of feeding, and it's at this point that the pathogens are transmitted to the new host. And this phase usually takes place at least 24 hours after the tick has attached to the host. So what advice can we give owners about controlling ticks in their pet? Well, before we discuss any treatment options, we need to assess the pet to see whether it is at risk of exposure to ticks. So firstly, it's important to consider whether the pet has access to areas that ticks are commonly found. So this could be land where deer or ruminants graze, or it could be land with tall grass, bracken, or lots of undergrowth. But it's important to remember that ticks can be found anywhere that there's vegetation. And so any pet, a dog or cat that has access to the outside should be considered at risk of ticks. And don't forget that any pets living in, or any dogs living in Essex or the adjoining counties should also be considered at increased risk of babesiosis. We then need to consider whether the pet has had ticks before, because if they have, this suggests that their lifestyle is a lifestyle that may mean that they get ticks again in the future. And lastly, pets that travel abroad may be exposed to exotic ticks and other tick-borne diseases, and so these pets should be considered at increased risk of ticks as well. So once we've confirmed that a pet is at risk of ticks, we should then be recommending that the pet receives a regular tick treatment. And this treatment should be easy to administer and it should kill ticks quickly. And this could be a product such as an isoxazoline, like afoxolana. And for dogs, where tick-borne disease is much more of a concern, we need to be recommending a product that kills ticks within 24 hours before disease transmission occurs. And with the increasingly milder temperature in the UK, ticks are able to feed throughout much of the year, and so we should be recommending continuous treatment all year round. So in addition to using an appropriate tick treatment, it's also really important that owners check their pets regularly, at least every 24 hours, for ticks. And especially they should look at some of those common areas like the head and neck. If a tick is found, it should be removed as soon as possible using an appropriate technique, like an appropriate method, like a tick remover, remembering to twist and pull rather than just pulling directly. And we can either do this at the practice, or we can show the owner how to do it so that they can do it at home if needed. And it's important not to stress ticks, and by either squeezing them or by using the more traditional methods for removing, like covering them in petroleum jelly or burning them, because not only could this cause damage to or injury to the pet, but the stress can also make the tick regurgitate its salivary glands contents, and therefore it can actually increase the risk of disease transmission. But as ticks can be so small, as we discussed earlier, especially those earlier life stages, it's important not to rely on removal alone, and to also use a tick treatment alongside this as well. So to summarise, tick-borne disease risk in the UK is rapidly evolving and growing. At-risk pets should receive continuous tick cover throughout the year, and we should check at-risk pets every 24 hours for ticks and remove them ASAP using a suitable method. In dogs, where tick-borne disease is much more of a concern than in cats, we should be recommending a product that kills ticks within 24 hours before they can transmit disease. I hope you enjoyed today's webinar on terrible ticks, and if you'd like any further information about parasites, please visit the Bowringer Academy at www.bowringer-academy.co.uk.